This is the manual muscle test for cervical flexion. Muscles being tested include the sternocleidomastoid, longus colli, and scalenus anterior. To complete the general test for flexion for grades 5 and 4, the patient is positioned in supine with the head on the table. The clinician provides a force into cervical extension. If the patient can tolerate moderate pressure, they receive a grade of 5. If they can tolerate mild pressure, they receive a grade of 4.
Keep the chin tucked, lift the head, don't let me move you. Relax.
For grade 3, the patient attempts to flex the cervical spine while keeping the chin tucked. If the patient is able to move through full range of motion without resistance, they receive a grade of 3 for the test.
Keep the chin tucked, lift the head, relax.
To isolate the sternocleidomastoid, the patient is positioned in supine with the head rotated away from the side being tested. The patient is then instructed to lift their head straight off the table towards the ceiling while the clinician provides a force back towards the table. The test is then repeated for the other side. If the patient can hold against strong resistance, they earn a grade of 5. If they can hold against moderate resistance, they earn a grade of 4. If the patient is able to complete the motion without resistance, they earn a grade of 3.
Try to push into my hand. Hold. Relax.
For grades below 3, the patient is positioned in supine with the head on the table. The clinician palpates the sternocleidomastoid muscle as the patient rotates from one side to the other. Rotation to each side is graded separately. If the patient is able to move through partial range of motion, they're scored as a grade 2. If there's palpable muscle activity, they're scored as a grade 1. And if there's no activity, they're scored as a grade 0.
Okay. Rotate the head to the left. Rotate the head to the right. Relax.